Episode 201, Study Session 4, Development of Skills in Implementing Medical Social Science. Introduction. Nigeria now has medical social workers in most teaching and specialist hospitals. In this study session, we'll examine the importance and the functions of medical social workers. Learning outcomes. When you have studied this session, you should be able to explain the importance of medical social services and highlight the functions of medical social workers. Definition of medical social work. Medicine and social work joined hands in 1905 with the establishment of medical social work at the Massachusetts General Hospital in Boston, under the enthusiastic, able encouragement of Dr. Richard Cabot. He and others recognized the need to understand more about social factors related to illness and its treatment, and to utilize social and community resources in comprehensive patient care. Medical social work is the application of social work knowledge, skills, attitudes, and values to health care. Medical social work addresses itself to illness brought about by or related to social and environmental stresses that result in failure in social functioning and social relationships. Skidmore, Thackeray, and Fairley, 1997. It also intervenes with medicine and related professions in the study, diagnosis, and treatment of illness at the point where social, psychological, and environmental forces impinge on the role effectiveness. Social medical services accept the World Health Organization's definition of health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or illness. Workers use problem-solving methods in assisting individuals, groups, and communities in solving personal and family health problems. They are involved in different levels of prevention, and these include 1. Primary, such as health education, encouraging immunizations, good mental health practices in families, prenatal and postnatal care. 2. Secondary, early screening programs for detection of disease, checkups, encouraging treatments, and social support. And lastly, tertiary or rehabilitation, preventing further deterioration of a disease or problem through psychosocial approach of the professional trained medical social workers. The distinguishing knowledge and skills of medical social work practice. Skidmore, Thackeray, and Fairley, 1997, said that medical social work is practiced in responsible relation to medicine. Its concern is with the welfare of patients and the casual contributing interrelationship of illness, family failures and breakdown, social stresses, environmental pressures and influences. Medical social work is shaped and guided by the attitudes, beliefs, knowledge, and acceptable ways of doing things by professionals serving in healthcare institutions and by the philosophy and practice of modern medicine. A. It requires a knowledge of illness and the psychological and social impact of diseases on the individual, the family, and the family interrelationships. B. It calls for the application and adaptation of social work concepts, principles, and ideas to the special needs of hospital and clinic clientele. C. The medical social worker explains the highly technical and specialized medical personnel and services to patients. For example, the medical social worker is always in contact with the patients at every medical unit the patient may find him or herself. And lastly, medical social work has a coordinate rather than subordinate or ancillary role of medicine and is responsible to the institution and the supporting public. The doctor is a clinical and medical authority and is held responsible under the law for medical practice. The medical social worker works on the psychosocial aspects of the practice. Functions of medical social workers in hospitals. 1. Assess the patient's psychological and environmental strengths and weaknesses. 2. Collaborate with the team in the delivery of services to ensure the maximum utilization of the skill and knowledge of each team member. 3. Assist the family to cooperate with treatment and to support the patient's utilization of medical services. 4. Identify with a cadre of other professionals to improve the services of the hospital by an interdisciplinary sharing of knowledge. 5. Serve as a broker of community services, thus providing linkage of patient need with appropriate resources. 6. Participate in the policy-making process. 7. Engage in research to assure a broadening of the knowledge base for successful practice. Study session summary. In this study session, we discussed that medical social service is gradually being introduced into our health system. All teaching hospitals and most specialist hospitals now have social workers as staff of the institution. Medical social work is the application of social work knowledge, skills, attitudes, and values to health care. Medical social work addresses itself to illness brought about by or related to social and environmental stresses that results in failures in social functioning and social relationships. End of study session 4. Thank you for listening.